Let's be honest. We all love our pets. They're basically family, but what if I told you that a little bite from your cat, one of those seemingly harmless nips, could actually land you in the emergency room needing surgery? Yeah. Let's dive into this surprisingly serious risk, that frankly most of us just overlook. This quote right here really says it all: cat bites are dangerously deceptive, and that's the central idea we're gonna unpack today. It's a warning that what looks like a tiny insignificant scratch on the surface might be hiding a massive medical problem just waiting to explode. So to really get how deceptive these can be, let me tell you about a 24-year-old woman now. She was a total cat person. Had cats her whole life. So when her cat bit her, she did what pretty much all of us would do. Right. She washed it with some soap and water and just moved on. She'd been bitten before. No big deal. But this time was a whole different story. Here's the really scary part. The speed we're talking. Less than 24 hours. In just one day. Her situation went from a tiny little puncture wound to a full-blown medical emergency. Her finger was bright red, totally swollen, and the pain was so bad, she couldn't even think about straightening it. You know that one detail from the emergency room tells you everything. The pain wasn't just a little sting on her skin, it was deep down inside her hand. For the doctors, that scream was a massive red flag that something was very, very wrong. So what in the world was actually going on? Inside her finger, well, doctors have a very specific checklist they use to figure this out, and for her, every single box was pointing to something really serious. The diagnosis was something called flexor tenosynovitis. I know it's a mouthful, but what you need to know is this: it's not just a skin infection, no. This is an infection that gets trapped deep inside the little tunnel, the sheath that your tendons run through. You know, the things that let you actually bend your finger, and this is how they nail the diagnosis. There's classic set of 4 symptoms known as Knavel signs, and if a patient shows up with all 4 of these after a puncture wound, well, that's considered a surgical emergency, and this young woman, she had all 4. Okay, let's break these down. Because these are the warning signs you really want to know. First, the entire finger swells up evenly, kind of looking like a little sausage. Second, the finger just wants to stay bent, you can't really straighten it on your own. Third, it's really tender. If you press right over where that tendon is, and fourth, this is the big one. It's unbelievably painful. If someone else tries to gently straighten it, so a CT scan confirmed it all, and the only way to fix it was immediate surgery. They had to actually open up her finger to wash out all that infection, and then she was on weeks of heavy-duty antibiotics. The paradox of the minor wound. Just think about that. All from a little cat bite, which, of course, brings us to the big question: why? Why are cat bites so uniquely dangerous? I mean, what makes them different from, say, a dog bite? Well, it all comes down to the anatomy of the bite itself. Think about it, a cat's teeth are like little hypodermic needles, super sharp, and narrow. They create this deep, tiny puncture wound, and then the skin on top goes right back up, basically trapping a nasty soup of bacteria deep inside. Right next to your tendons and bones. The core insight is the very reason a cat bite appears harmless is exactly what makes it catastrophic. Because the entry point is so narrow, the surface skin rapidly seals over the wound within minutes. Soap and running water can only clean the exterior surface, they cannot penetrate the sealed track. A dog bite, on the other hand, is usually more of a tear or a crush. It's often a bigger, more open wound that actually bleeds and can clean itself out a bit more easily. So the takeaway here is just crystal clear. Any animal bite is risky for sure. But because of that deep puncture, the risk of a really serious infection from a cat bite is way higher, especially on places like your hand, where there's not a lot of flesh between the skin and all those important structures. The biological contaminants. And what kind of bacteria are we talking about here? Well, it's a whole cocktail of them. Cat saliva harbors a highly concentrated biome of aggressive pathogens optimized to thrive in deep human tissue. The main bad guys often have bacteria called Pasteurella multocida, which is super common in cats' mouths. Why Pasteurella multocida is the primary threat? It flourishes in warm sealed, low oxygen environments. Drives rapid onset tissue destruction. Pasteurella is effectively locked inside of warm dark incubator, the tendon sheets shield from topical disinfectants and ready to multiply. You can also get other nasty ones like Staphylococcus aureus and Streptococcus pyogenes thrown in there. And we all know how much trouble they can cause, and if you let that trapped bacteria just sit there and multiply, oh, it can get so much worse. It can form an abscess, which is basically a deep pocket of pus, or it can spread to the bone, that's called osteomyelitis, or it can get into your joint, causing septic arthritis. All of these are incredibly serious and can cause permanent damage. Okay, so after all of that kind of scary information, we've arrived at the most important part of this whole explainer. What do you actually do to stop this from happening to you? Alright. First things first, the second a bite happens, your number one job is to wash it, and I don't mean just a quick little rinse. I mean you need to really get in there with soap and run it under water for several minutes. The goal is to flush out as much of that bacteria as you possibly can. And here it is second, this is the single most critical piece of advice: do not ignore the bite, don't just assume it's gonna be fine. Because it's small, or because the last time your cat bit you nothing happened. Every single bite is a brand new roll of the dice. So here's the key, just go get it checked out. Seriously, don't wait for it to get red and swollen and painful. If you see a doctor early, they can often give you a course of preventative antibiotics, and that can stop the infection before it ever gets a chance to take hold, saving you from a world of hurt and maybe even surgery. If you did to wait, keep this in mind: know the 48-hour watch. Monitor the site relentlessly for redness, disproportionate pain, or any of Conneville's sign. Also know the point of no return. Knowing this, the point of no return. Once flexor tenosynovitis is established, non-invasive treatment fail. Emergency surgical intervention is required to prevent permanent structure damage. A small wound is not a safe wound. Treat every puncture as a medical emergency until ruling out otherwise. So we'll just end with this thought: after everything we've talked about, when you look at that tiny little puncture wound from a cat, you're not going to see a minor injury anymore, are you? You're going to see a potential emergency, and the best part is now you know exactly what to do about it.